Hi, my name is M.Furrow, and I am here to do an assessment for Nursing 210 at Liberty University. This is my patient, Corey Colson. We're going to be doing an assessment on the face, the skin, the nails, the neck, and the head today. So we're going to go ahead and get started. The first thing that we're going to do is we're going to be assessing the skin on the upper extremities and also the lower extremities. I'm going to assess the skin. The color seems to be light brown, no noted lesions on either arms. I am going to check the same on the lower extremities at this time. I'm going to check pulses. I'm going to check capillary refill also. Bilaterally, capillary refill on each finger, which seems to be under 3 seconds. I'm going to check for skin turgor at this time. Any hydration, which there seems to be none. The next thing that I'm going to get started on is I'm going to note his nails. I'm going to be looking if there's any clubbing, if they are all well adhered to his skin. And Corey, what I need you to do for me is just kind of take your nails and do like this. The nails are negative for clubbing at this time. We're going to go ahead, excuse me one moment. We're going to go ahead and we are going to look at the head and the scalp. The hair is of dark brown color. It is soft. There's no noted lesions. It does not appear to be dry. The eyebrows are thick and full. The hair on the arms seems to be following with the male pattern, and that all looks good. From here we're going to move on and we're going to try to assess the nerve 5 while we're here, which is the trigeminal. We're going to use a Q-tip and we're going to test hard and soft end of the Q-tips. And Corey, what I need you to do is just tell me when you feel it to be soft.
Soft. Soft. Hard.
Okay, and that again was testing for cranial nerve number 5. Number 7 nerve is the facial nerve. And what I need you to do there is open and close your eyes. Okay, I need you to smile and frown, purse your lips, puff your cheeks. All of that seems to be appropriate at this time. We're going to also test Corey for any TMJ problems, any clicks or crepitus. Yep, I'm just going to feel that. There's no noted crepitus, no sounds of clicking. All is good at this time. We're going to also, the cranial nerve number 2 is the optic nerve. What we're going to do there would be a Snelling's test, which is a long vision test. The Rosenbaum test, which is where we would check his near vision. We don't have those, so we're going to just go on just to let you know that's how we would test the optic nerve number 2. Cranial nerves 3, 4, and 6 are the ocular motor and trochlear and abducens. The 6 cardinal positions of the gaze are covering one eye and following an object. So Corey, what I'm going to have you do now is just, I'm not going to turn this light on, but I want you to cover one eye, follow this. Down, good, good. Now cover the other eye, down, good. Okay, perfect. He was able to follow that without any problems. Next, what we're going to do is we already assessed eyebrows, facial features, that sort of thing. We're going to now look at cranial nerve number 2 to assess the inner eye. And this is where we're going to use the ophthalmoscope. And so what we're going to do is Look for a red light. I'm going to get real close. He had red light reaction, which is good. Noted in both eyes. And they are creamy of color. What I need you to do now is look straight ahead. I'm assessing for the twinkle in his eyes by doing the cover and on cover test. On cover, the other, on cover. That's excellent, excellent. Next, what I'm going to be doing is getting ready to scan the room. So I'm going to show you Professor Dow. This is where we are. We just got off work today, and we came down here and we snuck into the EEG testing room. Oopsie, I got that the wrong way. There we go. There's Corey again. Wave high, Corey. Okay, so next what we're going to be doing is the ear test. So with the ear test, what we're going to do is just look at the appearance of the ears, which seem to be symmetrical in size. We're going to take the otoscope and we're going to look into the ears for any type of drainage. They both ears at this time seem to be good. The cranial nerve number 8 is the vestibular cochlear, and we're going to do a Weber and a Rhine test. The Weber test we will conduct on the top of his head. You feel that? Mm-hmm. Okay, very good. And the Weber and the Rhine test, we're going to hear that. It's pretty loud, isn't it? Mm-hmm. Yes? Okay. Air conduction is greater than bone conduction by 2 to 1 on that aspect. Moving right along, we're going to be doing cranial nerve number 1, which is the olfactory. We're going to inspect the nose for symmetry. We're going to inspect with the light to make sure that it is a pink in color. Oh, here's a little pen light. We can do that. So we're going to just take a look. Yes, pink in color, mucosa intact. Corey, what I need you to do now is just make sure that you can breathe easily through each nasal passage. Holding one, breathe. Hold the other, breathe. Okay, very good. We're going to move, again, that was cranial nerve number 1, the olfactory nerve. We're going to do the smell test for that. So what we have here, Corey, I want you to close your eyes for me. Okay. Spell. What is that?
Banana.
Smell again.
Alcohol. I think maybe the lid.
The lid put through you. Okay, that was my bad.
Okay.
Okay, and then that is?
That's banana.
That is banana. Okay, so he was able to recognize, other than when I messed him up on that, what we were doing there. The mouth and the pharynx, cranial nerve number 9, which is the glossopharyngeal. We want to inspect the frenulum by using, and inspect the Wharton and the Stenson test. So Corey, I need you to open your mouth for me, lift your tongue up, move it back and forth. You need to see the insides of each cheek. Okay, very good, very good. Also, we will go on to inspect cranial nerve number 10, which is the vagus. Hi, I apologize, Professor Dow, but Corey received a phone call and it kicked me off of my video in the middle. So we're going to try this again where I ended, which was cranial nerve number 10, which is the vagus nerve. What we're going to do is have Corey swallow. Very nice. And while he's doing that, what we're doing is checking the tracheal for movement up and down and midline. These nerves are also used for swallowing, speaking, and the gag reflex. We could test those, but we're going to bypass that today. The next nerve that we're going to do is cranial nerve number 12, which is the hypoglossal nerve. Is tongue movement side to side. So I need you to, to the other side. Excellent, excellent. The neck is where we're going to finish up at. We have already tested the trachea. And what we're going to do now is just assess for symmetry. I'm going to feel the paravertebral muscles here. Everything is symmetrical and in line. The lymph nodes I will palpate. Pre and post auricular, occipital, submaxillary, submental, retropharyngeal, and supraclavicular nodes. Upon that, we'll just make sure that we don't feel any palpable lymph nodes, which there are none. We will also feel palpate the thyroid gland, which you typically would do from behind. Okay, it does not feel enlarged at this time. However, I will auscultate that. If there is enlargement, you can hear a bruit at times. So we're just going to listen, which there is none. Also, I'm going to auscultate the carotid arteries. Light pulsation without any bruits there. And the last thing we're going to do is the cranial nerve number 11. To do a test on that nerve, what I'm going to have Corey do is just kind of shrug his shoulders, and then I'm going to have him do that to the resistance of my hands. I'm going to have him push to the right and then to the left, and against resistance. And I think that that is going to conduct my assessment for my nursing 210. Thank you.